Hi guys, this is Azar, Doctor of Physical Therapy. Today I want to talk about the most important and most common elbow and wrist problems. As soon as we come out of the shoulder, we get to that joint, which is the elbow joint. Elbow is very settled and very firm joint, and it's a hinge joint, only has that motion. So we're gonna need a lot of stability on the elbow, and some people genetically have lack of stability on the elbow, and that can cause problems in the ligaments. Ligaments can get loose and we can lose the stability of the elbow, which can cause problems. But a lot of people can get problems with overuse of the muscles and tendons. What's going to happen, the people that type a lot, which it means that it seems that type can only injure the wrist and the fingers, but it's wrong. It can get the neck problem, which is obviously we talked about, and we can also get a forward shoulder posture with a lot of typing if we don't use the good ergonomic rules. And we can also get the elbow problems, which it can cause, like how it works on the muscle down here can affect the tendons up here, and we can develop what we call a tennis elbow or a golfer's elbow, which usually people that get these disorders, they are not tennis or golf players, but that's because of how it named, and is not really doing anything with people that they don't usually play these games. I'm going to show you a picture of the tennis elbow, which is very common. This is the tennis elbow. That's how the muscles can get inflamed during the tennis elbow, and then the muscles that are attached to the wrist, they can get inflamed up here close to the elbow, but is most likely because of the wrist overuse and repetitive motion in the wrist. Sometimes in the elbow too, for some workers that do a lot of elbow motions with the weight and they have instability, but most likely it's because of the too much working on the wrist. Another thing that can cause it is the hard grips. When you grip, actually your extensors muscles, which are in the top, they can get tight, and then if the extensor muscle gets too tight, the tendon of them, which is attached outside of the elbow, right here, right in that attachment, right in here, in that attachment, we can get inflammation. And that inflammation can cause micro tear in the tendon, and the tendon can get very painful and sensitive. People develop what we call tennis elbow. So, what's the solution? The tennis elbow best solution is a stretching. If we can really catch that on time with a lot of good stretches, we can get over it. So first stretch is going to be the elbow extension stretch. These are the elbow extensors, and we're going to stretch them by doing that. Very simple. Holding it 30 seconds to 1 minute and release. And we can do as much as you can to be able to hopefully get rid of that in the early stages. If we are in the late stages, of course we need physical therapy, and we need to go to the therapist or doctors to make sure that they can get rid of inflammation with probably ultrasound, massages, manual therapy, and even some people can develop at this stage some ligament instability and stuff in the elbow. We can work on that. Some people need bracing because the tendon gets rubbed to the bone and is getting very sensitive, and then they can put the brace on. So these are all the solutions for the tennis elbow, and we can also develop golfer's elbow. Golfer's elbow is the same concept, but it's the inside of the elbow, the muscles that do the flexion of the wrist. Is not as common because, as we said, most likely during the typing we do extension, and most likely during the grip we do extension. So extensors are more vulnerable to injury, but also flexors can get injured too. So if we do a lot of wrist flexion because of what we do, we can get inflammation right in here, and that can be very painful too. So again, in early stages, what we can do is going to be the opposite stretch. We can stretch that wrist flexors by doing wrist extension, and that's going to be a good solution for the golfer's elbow or flexor tendon inflammation. So these are two common elbow injuries. I hope if you can catch them in the early stages, just with these two simple stretch you can get rid of them. If not, we're gonna go over like more progressed stuff that can happen in the elbow. And if you get very weak or unstable on the elbow, we're gonna show you some other exercises for increasing the stability of the elbow, and we can go from there. Thank you for watching. Have a great day.